Thanks for joining us at Smilow Shares. And tonight's topic is cancer in the family. We have a super panel for everybody, and we thought maybe what we do first is we will introduce ourselves. And since I will be going first tonight, I'll introduce myself and my colleague. I'm Neal Fischbach. I'm a breast medical oncologist and one of the assistant medical directors to our clinical trials office. And I am joined by one of our spectacular CTO, clinical trials office, clinical research nurses, Katie Kelly. And our topic tonight is going to be to talk about how we make decisions about to participate in clinical trial and impact family plays.
Great. I'm Diane Viverios. I'm one of the social workers at Smilow. I've worked here for very many years, primarily in gynecology, oncology, but also now on the inpatient units at Smilow. My topic that I'm going to talk about is our support groups that we have here, as well as an intervention that we provide to families called Parenting at a Challenging Time.
Good evening, everyone. My name is Maddi, and I am the manager of the Integrated Medicine team, supportive care team, as well as the Singari Family Boutique. And tonight I will be talking to you about our supportive care team and our programs that we work to support here at Smilow.
Hi, everyone. My name is Courtney McGowan. I am a registered dietitian and certified specialist in oncology nutrition. I work at the outpatient Smilow care centers, and tonight I'll talk to you some about how you can support your loved one's nutrition as they go through their cancer diagnosis.
All right, and my name is Healy. I'm a licensed certified genetic counselor with the Smilow Cancer Genetics and Prevention Program, and I'll round out tonight's talk by giving you some insight into hereditary cancer genetics.
Fantastic. So we're up first to discuss clinical trials in the family, and we're going to do something a little bit different tonight. In putting this talk together, I'm going to share my screen. I came across a site that was put together by the cancer support community about hope and, frankly speaking, about cancer clinical trials, and all about how families interact in making tough decisions about clinical trials. And I thought it was absolutely perfect. And I convinced my colleague, Katie Kelly, to join us. And we are going to do an interpretive dramatic reading. But the reason the cancer support community made this booklet is because they wanted to hear from people with cancer, their voices about how they're making decisions about clinical trials. And really what they heard is a message of hope, that a decision to participate in a clinical trial is all about hope. Hope for you, hope for the future of other people following in your footsteps, receiving cancer treatment. And there's a ton to be hopeful about in cancer medicine these days. We got tons of new, highly effective treatments, but it's important to understand that the standard of care treatment that you or a loved one may be receiving now and the treatments of tomorrow are only made possible through clinical trials. So this is really a critical process that we go through. So our first vignette is titled A Better Tomato. Yeah. What are you doing, Grandma?
Planting tomatoes.
Well, why do you have two rows?
There are two kinds of tomatoes, the ones from last year and some new ones.
Okay. Why? Weren't the ones last year good?
They were, but this is a new type and it might be better.
Better how?
Well, they might make more tomatoes or taste better.
What else?
Some vines got sick. That might not happen with the new ones.
Why not? Just plant the new ones then.
Well, I want to be able to compare them. So I have two types that grow.
Why are you planting them in different places?
So I can tell the difference in how they grow.
Why?
You sure ask a lot of questions. So we can see the ones that make more tomatoes and see if they're healthier.
But what if the old ones get more sun or water?
Well, that's not going to happen. I'm going to make sure that they get some care. Otherwise, I won't really know which tomatoes are better for us.
I'm going to help. I'm going to count all the tomatoes when we pick them.
Yep, we'll keep track of that. And we can look at which ones taste better and how our vines grow.
This is an experiment, isn't it?
Yes, yes, it is.
Good. Let's do it together. I thought that vignette was terrific, and if it sparks any questions, please put them in chat. But really, it emphasizes, in my mind, it demystifies clinical trials. Clinical trials are just the way that we figure out if a new treatment is better than an old treatment, better in terms of efficacy, or maybe just better in terms of side effects. And it's really the essential part of what we're doing in cancer medicine. And it also emphasizes the theme that you, as potentially someone living with cancer, is a partner in the clinical trial process. And with that, we will move on to vignette 2, and I will take my bow off. How'd the appointment go today?
It was okay, but we need to talk. The doctor says he wants me to consider being on a clinical trial.
Clinical trial? What does that mean? Are you okay?
Well, it's time to make some decisions about my treatment. There's a new drug they're testing, and she thinks that could work for my cancer. You can only get it now on a clinical trial.
Research? You're going to be part of an experiment?
Don't look at me that way. It's not like I'm some kind of guinea pig. The doctor says this is a new promising drug.
If it's so promising, why do they need to do a research study?
Well, that's why they do the clinical trial, to find out whether it works better. What did she call it? The standard of better than the standard of care.
Will your doctor still take care of you?
Of course. She said they'll get top-notch care. They check out everything and keep a close eye on all side effects.
Does that mean more doctor's appointments? We're already at that center a lot.
Well, yes, I'll need to do a few more appointments and some procedures, but that's so they can see if the cancer's getting better and check on the side effects. I can handle that.
Which means more bills?
No, at least I don't think so. She said all the costs would be covered, and if there's any problems, we can talk to them and see if we can get help.
But it's a trial, right? What if you don't get the new drug? What if you get a placebo, some sugar pill?
Well, it doesn't work that way. I will either get the new drug or best thing that they have right now.
So are you going to do it?
I think so. I feel like it's the best option for me now. And you know, even if it doesn't help me, it might help other people with cancers like mine.
What if we have questions? I know I do.
Well, we can go together next time. It would be great if you were there with me. And the doctor says that they'll explain everything. We can ask any questions we have. It's called informed consent.
Okay, I'm there with you every step. You know that, right?
Thank you.
So I think this vignette really highlights one of the seminal things. First, that deciding to go on a clinical trial is a team effort with the family. And second, there are a ton of questions and a lot of misperceptions. The guinea pig, the placebo questions, these are very common questions, and these are all things that your team of providers is ready to answer. And we have one last vignette, which we'll go through, and then we'll hand over the mic. Okay. Most people participate in a clinical trial because they hope to benefit from the treatment. You look tired, dear. Is everything okay?
Well, yes, but the treatment's getting to me. The last scan looked pretty good, though.
Does that mean you're getting better?
Well, it doesn't mean I'm getting worse.
Is it worth it being on the trial?
I think so. It gives me hope.
What if it doesn't work?
Then I guess we'll try something else, another trial. We have to keep looking at all our options.
What keeps you going?
You and Dad, and well, life. There's so much joy to be had. I want to stick around for more, but there's also something else.
Like what?
I want what I'm going through to mean something.
What do you mean?
Me being on a trial will help other people. They learn from it, even if it doesn't work for me.
I never thought of that.
I think about it all the time. I don't want other people to have to go through this. It's about a better future for everyone.
And that is our presentation. I think that third vignette really hits upon what I think is one of the seminal themes in people electing to go on clinical trials, that it's about hope. It's about hope for a better treatment for yourself and potentially better outcome, but there's a huge element of reaching behind you and helping the person that's next, and building better cancer treatments for the future. And this foundational principle that the standard of care of today is based on the clinical trials of yesterday. So if there are any questions about clinical trials at Yale, how do I get involved? How do I hear about them? We can put them in the chat now and answer, or we can wait until very end and review questions then. We'll give people a second. I don't see any questions in the chat at the moment, probably blown away by our dramatic performances. I want to thank Katie, Kelly. But with that, then I will hand off to Diane, who will tell us about our programming and support groups.
Great. Thank you so much, Neal and Katie. That was very entertaining and informational. So I'm going to try to share my screen right now. This is it. Okay. So my talk is about cancer. The title of this in-service or training is Cancer and the Family, but I say it's cancer in the family. While our patients are the ones that are living with the cancer in their body, we all here at Smilow know that cancer really affects everyone in the family. That's what social work is around to help with, helping both our patients and their families find a way to cope and be resilient in the face of an enormous challenge in life. And to be honest, cancer affects everyone in a family in very unique and different ways. That impact is really determined by lots of different factors, the sort of role that a person has in the family, the number of kids in a family, the structure of the family, the life stage that the family finds themselves in, and just the personalities and temperaments and strengths and sort of areas that each member of the family find challenging. So, our programs try to take into account all of those and see both our patients and their families as whole entities, and we try to help where we can. So we also recognize that family is a concept that can be defined both formally and informally. A family is not just a mom, a dad, and a couple of kids anymore. It can be an extended family. It can be a family that's not related by blood, but has a strong kinship network. We recognize all of the different ways and shapes and forms that families can come in. So, social work really is here to support our families. One of the major ways that we do that is through providing support groups. The benefits of support groups at Smilow is that the groups are led and facilitated by trained clinical social workers. There are some peer support groups, both within the community and even within the Smilow community. Those don't have trained therapists or counselors leading them. And so sometimes there is a really big benefit in terms of having social work kind of facilitate the group, both because we're embedded in the programs here. So we're very familiar with the kind of cancers that are sort of covered in the support group, and we can help make sure that everybody has airtime. We recognize that sometimes people like to know that support groups are available, but support groups aren't necessarily really for everybody. But I think we would all encourage you to try our support groups, and they don't cost anything. At this point, we're doing all our groups pretty much over Zoom, over the computer, which makes it really convenient for our patients and our families. So I put together a list of the groups that we do run here at Smilow. I highlighted our caregiver support group because that really is the group for family only. It's not really, patients themselves don't come to that group, but it's really a recognition that usually caregivers find themselves with no time to take care of themselves because they're busy taking care of everything and everybody else when someone is sick in the family. And so this is a space for caregivers to get support themselves, to get some ideas about how to juggle everything. Some of our support groups have been running for years. Our prostate cancer support group in particular has really been probably very well attended for at least almost 20 years. I've worked here for almost 20 years, and that group has been very active the whole time that I've worked here. Some of our support groups have been generated by families saying, we need a support group. Our neuroendocrine cancer support group was really spearheaded by a patient effort who she really identified the need to bring people together. So like I had said previously, we do have, there's not a support group for every single kind of cancer we take care of. So we also have a general support group that anybody with any kind of cancer can go to. And that's the patient support group in out of Orange, that our Orange Care Center social worker and a nurse up there facilitate. Parenting at a challenging, so I'd encourage you to think about the support groups. They're always there. And if you don't like them, you don't have to come back, and that's all right. But sometimes people find them very, very helpful. Parenting at a challenging time is sort of, it's not really a program, it's an intervention that social workers are trained to do here at Smilow that really provides a support to families who are raising children. What PACT is it's really guiding parents. It's not, it's a focused and time limited kind of intervention. We sit down and meet with the parents in the family, or maybe the grandparents, or the adults that are raising the children. And it's available at any time during your treatment. So, you might want to talk to a social worker when you're first diagnosed, but then you figure out how to communicate with your kids and how to help them navigate the challenges. But something comes up in the middle of treatment and you can talk to the social worker again. This program is really an educational program to support and strengthen parents who are in crisis because of a cancer diagnosis or an illness related issues. This program is evidence and literature based about what helps kids cope with a parent's illness. What PACT is not, it's not family counseling. It's not counseling your kids. It's not the social worker telling your children about your diagnosis or if you've had a recurrence. And it's not really family counseling at the end of life. What it really is sitting with parents to help them think through the words, the emotions, the issues, what their children are like, how best to present and help children understand and cope with what you're going through. The kind of areas that we cover when we sit and talk to parents about this is really what developmental stage is your child in right now, and how does what you're going through affect their ability to understand and cope with your illness. We talk about strategies to communicate with kids. Talking to an 8-year-old is really different than talking to a 16-year-old, and we go through those kind of differences. We would talk about issues that arise during diagnosis and treatment and different strategies to use. We kind of help you understand what would be the warning signs that your kids are actually struggling and would need more help. We talk about sometimes we'll talk about sort of doing advanced planning that any parent needs to do when they have dependent children, both kind of planning for them financially and legally. And then, there are some families that are approaching end of life, and we help families really understand what helps kids at that time of life. I'm not going to go into all of the kind of things that we talk about in PACT. I just want to cover the topics that we cover, because the issues are so in depth and so unique to each family, that this is what social work is really here to help you do. So I would encourage you, if you're listening to me talk and saying, wow, my family really needs that, reach out to your clinical team and ask them to have the social worker that's assigned to your team give you a call or set up a meeting with you. So, but I will go over a couple of the basics. One thing that I've seen over many years is that until parents really kind of get to take care of their own feelings, they're not ready to talk with kids. So a lot of times parents will say to us, you know, I don't have all the facts yet. I'm kind of freaking out. I'm really stressed out, but until I really have a plan, I don't want to talk with my kids, which to me and to us makes perfect sense. And a lot of times the support that you get from talking to the social worker about what is this like for you helps you to become ready to hear what it's like for your kids. Kids really do take cues from their parents, and they watch how you're dealing with your own feelings. They can kind of tell whether you're able to whether they're able to ask you things that they're really worried about or whether you're just not really ready. Kids are very sensitive. Sometimes in the PACT meetings, we encourage you to practice either with us or when you go home alone in the shower with your partner or another family member, how to talk. You know, what exactly are you going to say to your kids? And whenever I do a PACT meeting with parents, I really encourage them to think about how would you respond to your kid asking you very difficult questions. And I will come out because kids will come out because they don't have the filters that grown-ups do a lot, and they will ask you and at a very young age, are you going to die from this? And that's a really hard question when you're newly diagnosed. I think what PACT would kind of guide you very briefly is to be ready for that, to be prepared for that, and to sort of be both honest but hopeful. You know, to sort of say, you know, I have something that this could end up happening at some point in time, but I'm doing everything I can to get healthy and be better. And that's not happening right now. And if it started to happen, I promise you we would let you know and we would make sure that you are taken care of. That's kind of like a little summary. There's a lot more to say about that topic, but that is one of the, I think that's the hardest issue for parents to tackle with their kids. So some pearls of wisdom from the PACT program is that, you know, really identifying what your illness is, really understanding that kids hear things when you think they don't hear anything. And if you're talking about this with your partner in another room or somebody on the phone, they're going to overhear you and they won't understand what you're talking about, or they may worry way more than they need to. It's important to sort of really convey warmth and an openness to your children's questions. And that really requires you to be taking care of your own emotions to do that. And a lot of times kids will ask questions that you think are really big, but they're actually really about, can I go over to the sleepover at my best friend's house in 2 weeks? Because I don't know what your cancer means and I don't know if I can do my sleepover and I really want to do my sleepover. So to sort of take the time to ask, to make sure you're understanding what exactly your child is asking. And to also realize that not every question needs an immediate or detailed answer. It's okay to say, I don't know the answer to that question, but I'll try to find out the answer. I'll talk to my doctor or my nurse. It's also important to respect a kid's wish not to talk, but also to sort of say to them, and this is more, teenagers do this a lot more than little kids, but sometimes little kids do it too, to sort of say, I can see that this is hard for you to talk to me about, so we don't have to go on and on. Periodically, I might have to we might have to do a family meeting to give you updates. And if I'm seeing something that is worrying me about how you're dealing with all this, we're going to sit down and talk. But don't let your kid worry alone. Help the people that are helping you care for your children to understand kind of what's happening for you so that they can be a resource for your kids. Try to maintain a child's usual schedule as much as possible. but also sometimes cancer requires activities to get kind of pared down and sort of made more manageable instead of doing 4 sports at a time, sort of saying you can pick one, but then, you know, you can do one that I can take you to, and you can do one that Auntie Michelle can take you to, but doing 4 is too much right now. And then really making a point of carving out just special family time that's protected, that you don't answer the phone, or you're not texting on the phone about how you're doing with all your friends. Really devote undistracted time to your children and your family. Sometimes hospital visits do help kids feel less worried, but preparing them for those visits is really important. Social work helps with that all the time. And also taking care of yourself is really important. So in conclusion, I don't know if anybody on this call knows who Mr. Rogers is. He's sort of a bit old school, but Mr. Rogers is great. And he has always said feelings that are mentionable are so much more manageable than feelings that aren't. And I think that's the whole point of the PACT program, is really helping people just cope with the challenges of cancer and to find the strength within themselves, within their family, within their community, to navigate the challenges and become resilient as much as possible. I think parents always want to protect their kids. But the reality is cancer can teach kids so many things about strength and courage and hard work and perseverance and hope and love. So please don't hesitate to, reach out if these are kind of programs that would be supportive to you and your family. And if anybody has any questions for me right now, I can take them. When will the groups ever become live instead of on Zoom? I think that if there is a group that you're very interested in, you should, I know Maddi is going to talk about the Supportive Care Navigator program next, and she can hook you up with the leader of that particular group, and you can ask that question. I don't really know, because honestly, the attendance has really gone up since the groups have gone on Zoom. A lot of times it's very hard for people who are coming here so much for so many appointments to just come one more time. So I'm sorry, I don't have a good answer to that question. But certainly, put it to the group leader. There are some peer support groups that are kind of meeting up now. So I would encourage you to talk to the social worker that's assigned to whatever cancer you might be having to deal with. And if our groups don't meet your need, there are community resources as well that we can refer you to. That's
Thanks,
okay.
Matt.
All right.
Yeah.
Great.
So then we'll segue to Matt, and we'll have opportunity for more questions at the end. For anyone who would like to ask questions, in the bottom of pane, there's a Q&A pop out and a chat pop out. You can put questions in either one of those. And next up is Madeline Kaehler, who's going to tell us about some additional resources for support.
Great. Thank you, Neal. All right. So thank you all for signing on this evening. My name is Madeline, and I am the manager of the Supportive Care Access Program here at Smilow. And this is a new team, relatively new, as of about this time last year. So I really wanted to take the opportunity to explain a little bit more about what our program aims to do and how we actually can help patients throughout the continuum of their cancer care. So first and foremost, what is supportive care? Supportive care kind of boldly has a widely, a very triaged kind of differentiating definition. And really what the Multinational Association of Supportive Care and Cancer defines it as is supportive care aims to be a preventative and management type care model for the adverse effects of cancer and its treatment. And really what that means is that encompasses both the physical outcomes and side effects of cancer treatment, but also the psychological symptoms that a patient may be experiencing during the journey of their cancer treatment. So supportive care really embodies a lot of not only the physical side effects, but also some of the psychological and psychosocial aspects of cancer treatment as well. So from a supportive care background kind of information for you all, the supportive care model really came to be in the 1960s and the 1970s when chemotherapy really became a widely used regimen in treating cancer. And what supportive care aimed to do was to minimize the negative side effects of chemotherapy. And that really focused on the physical aspects of chemotherapy, those negative aspects. So actually in the beginning, supportive care really was a form of pain management control. Now, fast forward about 50 years, and as medicine becomes more optimized and more research has been done, supportive care really encompasses a broad definition that spans more than just the physical side effects of chemotherapy. And that includes a patient's spiritual health, emotional well-being, psychosocial well-being, and in addition to their physical health. So really supportive care encompasses all of these domains to ensure that the patient is as minimally as possible experiencing negative toxicities from their cancer regimens. So in research, supportive care has been shown to improve the quality of life, the symptom burden, the survival rate for cancer patients who receive supportive care services early on and throughout their treatment has been shown to actually improve as opposed to those who do not have supportive care resources. And it actually helps the overall health economy at large because supportive care resources has actually been seen to decrease hospital admissions and emergency department visits as a whole. So really supportive care is supposed to, when it's well implemented, to ensure that the patients who are undergoing cancer treatment have all of the resources that they need to thrive before, during, and after cancer treatment. So here at Smilow, after everyone started returning a little bit from the pandemic and we started matriculating some patient feedback, and it was loud and clear to us that we could do a better job at advocating for and really educating patients on all of the supportive care modalities that we have here at Smilow. And on this page here, I have 15 of those awesome supportive care programs that we support. So our team acts as a centralized access point for patients and clinical teams to utilize. And what our navigators will do is, depending on, what our conversation with patients leads out to be, we're kind of going through a mental screening process in our head saying, I think this patient would be a really good fit for social work, for some of Diane's support groups or palliative care, et cetera. And what our team will do is actually refer patients into these respective clinics so they can get scheduled. And so after hearing this patient feedback, this supportive care access program or centralized kind of access point for patients to utilize really came to be. So we kind of work off of two separate workflows here. And the one that I will share with you all today is that patient workflow. You may self-refer into us by giving us a call, emailing us, and just kind of explaining if there are any problems that you're facing. What are you feeling? Is there anything that we can help you with throughout your cancer diagnosis and treatment options? Patients may come to us for any number of things. It could be as simple as, I'm curious as to what you have. Can you tell me a little bit more about it? To very acute conversations, and we can get them in touch with resources almost immediately. On the other hand, we also work very closely with our clinical teams. So we within Smilow have partnered with our physicians and our clinical teams and nurses and social workers to ensure that they have the ability to send us a referral via our electric medical record. So sometimes newer patients, new diagnosis patients, they may be referred by their RN coordinator to just have a general overview of supportive care, education and support. And if any of these 15 programs can be of help to them, we will refer into them. So it really has become a nice partnership between clinical teams and how to navigate cancer treatment through the whole continuum of care while also incorporating lay navigators. And lay navigators are non-clinical navigators who are trained generally in a public health background. And with all of the training that our navigators do have, they did undergo extensive orientation with each of these 15 teams so that we can better understand what patients may fit into different teams well, what makes them eligible to be seen by each team, et cetera. So in just speaking with patients, we can actually connect them with resources that will benefit their individual needs with where they're at in their cancer.
Oh. Am I the only one who has a glitch with Madeline? I think everybody does.
Yeah.
We'll give it a moment, see if we can fix that. And then if not, maybe we'll move on to Courtney. And when Madeline logs back on, we can finish up. Give her 30 seconds of bio break for everybody while Madeline logs back in. Courtney, what do we think? Should we segue into nutrition and then we'll come back to finish up the support care?
Sure. Sounds good. Let me get my screen shared. Okay. Oops. Sorry about that. Okay. Okay. I just want to put it in presenter view here.
Courtney, I think if you hit the little projector screen down on the lower right-hand corner.
Thank you. It's hidden by my screen sharing. Give me 1 second here.
I think you can also go to slideshow at the top. And then, yep, there you go.
No, okay,
I think if you do from beginning.
From current slide. Okay.
Yeah, there you go.
Thank you.
You're
Thank
welcome.
you very much. You think I'd be better at that by now. Okay, great. So, perfect. Thank you for having me today. As I said tonight, I'd like to talk with you about the role that family members can play in supporting your loved ones after they receive their cancer diagnosis. So in much of our society and around the world, the idea of food and family can be synonymous with one another. Most times when loved ones come together, food is involved in one way or another, right? Whether it's meeting at the dinner table to share the details of the day, gathering at a potluck family picnic, or a church group when everyone brings a favorite dish, or finding a few minutes of quality time to connect with a child or loved one over an ice cream cone on a hot day. So when there's an accomplishment, how do you celebrate, right? Usually you might splurge on a meal at a favorite restaurant. When people get sick, how do loved ones respond? They often bring food. So food is so much more than a way to nourish our bodies. There are patterns in how people eat. There's routines that we fall into, and sometimes generation-old recipes that we rely on. And so food is how we connect with one another. It's how we express kindness, compassion, and love. And so when someone receives this cancer diagnosis, it can cause them to have to eat differently or want to eat differently than they're typically used to. And so this can have an impact and be an adjustment for everyone around them. And so I think it's important to acknowledge that. When we're talking about nutrition with such a diverse audience as we have today, I always think it's important to differentiate between those who are able to eat without any issues, because some of you fall into that category, versus those who are really experiencing symptoms that can make eating difficult, whether it's nausea and vomiting, mouth sores, taste changes, or just a general lack of appetite. And so there are really two different camps that people fall into, depending on where they're at in their cancer trajectory. And so what I want to start by doing today is to review the guidelines for a healthy diet, and then I'll lay out ways that you can support your loved ones depending on how they're eating. So the American Institute for Cancer Research brought together a panel of world-renowned independent experts from across the globe to review decades of evidence on cancer prevention. And they came up with these evidence-based guidelines for what to limit and what to eat. They also included in these recommendations a recommendation to achieve and maintain a healthy weight. They found that to be important, as well as exercise-based recommendations. But for the purposes of today, we'll focus on the nutrition-based ones. And so what they suggest is to limit red and processed meat, such as beef, lamb, pork, to less than 18 ounces per week. So this includes things like bacon, sausage, and other smoked meats. Limiting fast foods and other processed foods that are high in fat, starch, and sugars, and also limiting sugar-sweetened drinks. So a good overall goal when it comes to sugar is to eat 30 grams or less of added sugars per day. Now, this doesn't include the naturally occurring sugars that come from fruit or unsweetened dairy products. This is really just grams of added sugar. So what's convenient is that in the past couple of years on our nutrition facts labels on packaged foods, they've broken out sugar on that label from total sugar, but there's also a line for added sugar. So it's very clear how many grams of added sugars are in foods that have labels. And so again, the goal of 30 grams or less of added sugar per day is a good guide to strive for. They suggest limiting alcohol intake to 1 drink or less per day for women, 2 drinks or less per day for men. And they suggest not using supplements for cancer prevention. And so rather than taking vitamin, mineral, or herbal supplements, which might interact with your treatment and are not as well utilized by our bodies, really aiming to get all your nutrients from food is your best approach. The exception to this would be anything that was prescribed by your doctor. And so it's important that you inform your doctor about any supplements that you might be taking. So when we say to get all your nutrients from food, this is what they mean, focusing on whole grains, so whole wheat options, quinoa, barley, brown rice, and other less processed grains, including beans, nuts, seeds, as sources of plant-based proteins. And getting as many colors as you can from fruits and vegetables. And so by eating this rainbow of colors, it sounds like a really remedial approach, but it has such a big impact. And so by maximizing colors, we can maximize the variety of vitamin, mineral, and phytonutrient intake, which are all so important in helping nourish our body in a way that will help it best fight disease. And know too that this produce can be fresh, frozen, or even low sodium canned options. And so adding this produce, these fruits and veggies to your diet doesn't mean that your grocery bill needs to increase. So just kind of emphasizing that. In doing this, the other approach to take is to use the guide of the New American Plate to help dictate your meal choices. And so if you strive to do 2/3 of your plate being plant-based, which are your fruits, vegetables, whole grains, nuts, seeds, and 1/3 animal-based, so your chicken, fish, pork, beef, and animal-based dairy products, that's really going to align your plate in a way that helps get you toward what the guidelines are. And thinking of meat as a condiment rather than the focus of the meal. And so really this is why it's the New American Plate, because traditionally we would choose our meat and then put the veggies around it. In this case, we're saying plant forward, put those fruits and veggies, those whole grains on the plate first, and use meat more as a condiment. And so how can you support your loved one in meeting these recommendations when they're able to eat without any issue and their appetites are good? So that's that one group that we had mentioned. So we'll start there. So first, acknowledge acknowledging that these recommendations are in line with what's recommended for prevention of heart disease, diabetes. It helps promote weight loss and just good health overall, whether it's for adults or children alike. So what's great is that recommendations for cancer survivorship, cancer prevention are the same guidelines that are really recommended across the board for healthy eating for other comorbidities as well. It's the better way for everyone to eat. So get on board. That's number one. Second, be open to trying new foods. So help find plant-based recipes to try. If you're the chef in the house, be willing to cook these healthier options. If your loved one does most of the cooking, don't protest when the table now has more fruits and vegetables and whole grains on it. Again, be supportive of that. And try and take this as an opportunity for you to get healthier as well. Third, be supportive of the content in your pantry and your refrigerator looking different. So keep high sugar, baked goods and processed snacks out of the house. As a loved one, if these are, as a caregiver, if these are foods that you feel strongly about eating, have them when you're out of the house rather than bringing them into the house. It's really hard to make good food choices when there's less healthy food choices around, right? We've all experienced that when the snacks are calling you from the cupboard. So keeping healthy snacks around is going to be important. And that can be dried fruits and nuts. It can be homemade fruit puree popsicles, low-fat yogurt, so choosing healthier snacks like that, and just fruit in general and veggies. And then fourth, there is, eating this way doesn't mean that you have to throw away those beloved family recipes. You can try to modify them to have less sugar or fat. Is there a way that you can add more vegetables to them? If that's not an option and you insist on having them the way they are, I get that. Those valued family recipes are valued for a reason, right? And so maybe it's just choosing a smaller portion of them, and then pairing them with a more vegetable-based dish or a large salad. So it doesn't have to be eliminating those recipes entirely, just making that overall plate and that overall meal look different and more healthy. So when we talk about those who are struggling to eat and how we can support them, that conversation looks a bit different. So first, I want to acknowledge that cancer diagnosis can force the role of the chef in the house to fall on someone who has never cooked before. And I hear this so often, as recently as yesterday, and how that can make a couple or a household struggle when that role has to change. And now you have someone who's never cooked having to learn not only how to cook, but how to meal plan and grocery shop. And it's really a huge step to take. So my advice is to keep meals simple. In fact, simpler meals and foods are often more appealing to loved ones who have low appetites. The longer it takes to prepare a meal, the higher the chance that your loved one doesn't want that meal by the time it's in front of them. So I hear that often too. Oh, that I had chicken a la king sounds so good, but by the time all the recipe came together and it was on the table in front of them, they wanted nothing to do with it. So having foods available that are simple, easy, and quick are really of most value when it comes to overcoming some of this loss of appetite. Also, as caregivers, I think it's important to understand how hard it can be for those with cancer diagnosis to eat. And I think it's important to acknowledge that. I often hear caregivers say, I don't understand why they can't just eat the food in front of them. So while you may not be able to understand why, as caregivers, we have to trust that eating can be a real struggle for these loved ones who are working harder to eat than you may realize. And so as far as your role as a caregiver, some strategies to help increase success at mealtime when eating is difficult. So again, as I said, keep the food simple. Offer soft, moist foods. So these require less chewing. People can just eat more. The more work it is to chew and swallow, that all contributes to the effort needed to eat. So by keeping things soft and moist, again, the outcome is generally that people can eat more of it. Encouraging small meals and snacks throughout the day. So offering a larger portion is sometimes enough to take an appetite away. So when you've got a full plate of food in front of you, if appetite is low, it's not appealing. And so offering a smaller portion, patients can usually get through that a little better. And then maybe there's another smaller portion behind it. Another strategy here could be to use a larger plate and put a small amount of food on it. So if there's if the food on the plate looks like a smaller quantity on a larger plate, it can be less overwhelming for someone who's struggling to eat overall. kind of play a little mind trick there. And then providing high calorie, high protein foods to increase calories per bite. So again, when bites are minimal, we're trying to maximize calories per bite to really, pack the largest punch in the little bit that they're able to take. And so to be specific about some of the foods that often are effective to kind of check these boxes, I find that peanut butter and cheese are two foods I suggest often. They're high in calories, they're high in protein. Whether you pair them with crackers, you can dip apples in them, you can make a peanut butter and banana sandwich. Those all are really high calorie, high protein, and people can kind of wrap their head around those. A Greek yogurt is good. Some people do well with cottage cheese and fruit. Even opening a can of clam chowder or baked beans, tons of protein in a can of baked beans. Sometimes the taste changes, maple syrup flavor carries over well. So again, another way that those baked beans can pull through, and really just trying to identify good protein and calorie sources. And then the other strategy is to provide distractions at mealtime. And so when we're trying to lose weight, right, and our appetites are good, we don't want the distractions from the food. We want to focus on our meal so we feel more satisfied by it. But in this case, we're trying to remove some of that, person versus plate feel when they've got a lot of loss of appetite going on. And so by having them sit in front of the television, if they can kind of eat mindlessly, there's value in that for people who have low appetites. Eating outside, the distraction of nature and the fresh air can sometimes help overcome the nausea they might be experiencing. So that's a good strategy too. And having a family member or friend join to provide social distraction. I think of my patient who was eating so poorly up here and had a trip planned down to Florida to visit her daughter. And she got down there and spent 2 weeks down there and came back 6 pounds heavier. So, there's value in those social interactions, and the mental health that brings as well can sometimes contribute to just a better association with eating. So bottom line, if we do have dietitians in all of our Smilow Cancer Care Centers, I encourage you to ask for a nutrition consult. If you are, we can provide one-on-one help and strategies for your specific situation. So please utilize us, ask for nutrition consults. And thank you for your time today. We're happy to help however we can.
Terrific, Courtney. Thanks so much.
You're welcome.
I don't see any questions in the chat yet, but we have time for more at the end. And then we'll circle back, Maddi, who's reestablished internet contact, and if there's any additional info you want to share.
Right now? Oh, you're on mute, Neal.
We can wait till end, Maddi. If there are additional slides,
Okay.
I think you got cut off right at the end.
You got it.
But for right now, why don't we will segue to Claire Healy to talk to us about genetic counseling.
All right, wonderful. I'm going to share my slides here. And all right, just to cross check, are you seeing my slides?
Yes, we are.
All right, perfect. All right, well, thank you all so much for joining. I know I'm the last speaker, so I'll try to wrap things up so we have room for questions. Again, my name is Claire Healy. My goal for tonight is to introduce you and help familiarize you with hereditary cancer genetics and explain a little bit about how genetic testing can be used to guide medical care. So in thinking about cancer, a common question is all cancer hereditary? And the answer is no. The majority of cancers are not hereditary. The vast majority of cancers, about 70%, are sporadic, meaning they occur due to random events in our cells over time. And about 15 to 20% of cancers are familial. And these cancers occur due to a combination of risk factors, including some shared low-level genetic factors that are called SNPs, as well as shared environmental and shared lifestyle risk factors. And families that have a familial predisposition to cancer may have a higher risk to develop certain cancers, but that risk is not as high as we see in hereditary predispositions. And the ages at the time of those cancers still tend to be right in line with the general population. Only 5 to 10% of cancer is inherited or hereditary, and we're going to discuss that a little bit further in slides. So when it comes to hereditary cancer risk, there are usually some red flags that we can look for in a person's personal or family history of cancer that may suggest the possibility of an inherited risk to develop cancer. And these can include earlier ages of onset of cancer in the family, typically prior to age 50, or multiple cancers in the same person, such as a person having multiple breast cancers, multiple family members who've developed the same cancer. So maybe we're seeing multiple people in the family with colon cancer, for example, or multiple family members with related cancers. So if there's both breast cancer and ovarian cancer in the family, if there's pancreatic cancer, colon cancer, and uterine cancer in the family, that could all be a red flag for hereditary cancer syndrome. Additionally, rare cancers, so things like pancreatic cancer, ovarian cancer, men who've had breast cancer occur less commonly than other types of cancers, so those would be a red flag. And if obviously there's a hereditary cancer syndrome that's already known in the family or in a relative, that's a risk factor for other people in the family to have that same hereditary cancer syndrome. And Ashkenazi Jewish ancestry is also a risk factor for hereditary cancer, particularly for hereditary breast and ovarian cancer. So I want to talk about genes. This is what I do every day, so I can't let a presentation go by without talking about genes. Genes are the body's instruction manuals. So they control different functions in our body, and they can determine the color of our eyes, our hair color, our height, but they can also determine which diseases someone may be at increased risk to develop. And so some of the genes in our body are responsible for preventing cancer. So they perform that cancer prevention job by producing proteins that the cells in our body use to keep growing and dividing in a sort of regimented way. And we inherit those cancer prevention genes in pairs. So we get one copy from our mother, the other copy from our father. And when cancers are sporadic or random, the person is born with healthy copies of these cancer prevention genes, which then acquire DNA damage, which can also be called a mutation, over time. And once the cells have acquired enough mutations, they begin to lose that ability to regulate the way they're growing and dividing. And so they start to grow and divide out of control, which allows a tumor and a cancer to form. In the case of a hereditary predisposition to cancer, individuals are born with a mutation already in one of these cancer prevention genes, often because they've inherited that mutation from a parent. So this places them at an increased risk to develop cancer and to possibly develop that cancer at an earlier age because they're sort of born down one line of defense against cancer development. So in terms of genetic testing itself, it's usually done from a blood or saliva sample. Most often blood, but saliva is our backup option if patients aren't comfortable with a blood draw. And in terms of the cost, most insurance companies do cover the cost of genetic testing. I think that's a common misconception. Genetic testing can be expensive, but for the vast majority of people, there will be insurance coverage to help offset that cost, especially for those who have a personal and strong family history of cancer. The exact cost differs based on the person's individual insurance plan, their personal or family history of cancer, but in situations where the person has a high deductible plan, maybe doesn't meet their insurance company's criteria, there are genetic testing laboratories that offer low cost genetic testing. And so that cost is usually a maximum of $250 for most patients. So I want to transition just in kind of talking about how genetic testing can be useful to patients who may have already been diagnosed with cancer, as well as those who have not. So in terms of understanding cancer risk, genetic testing, it can be helpful because it can help to provide an explanation for why someone developed cancer, it can help to provide an explanation for a family history of cancer. And importantly, for those who've never been diagnosed with cancer, it does not tell us if they have an active cancer diagnosis. It can only tell us whether or not they have an increased risk to develop cancer over time. Results of genetic testing can also help to guide medical management, like things like surgery. So an individual with a hereditary risk to develop cancer whose risk is significantly higher than the general population may opt to have risk-reducing surgery to help prevent cancer from developing. So maybe removing healthy breast tissue or removal of the ovaries and uterus to reduce the risk of developing cancer. And risk-reducing surgery is obviously not available to reduce the risk of all different types of cancers. But in addition, this option may not be recommended to everyone with a hereditary predisposition to cancer. So we do recommend that these conversations about risk-reducing surgery be made after careful consideration with a healthcare provider. And genetic testing can also help to inform an individual's screening plan. If a person's risk to develop cancer is significantly higher, they may qualify for increased screening. So that could include the addition of breast MRIs to routine mammogram screening for breast cancer, or having colonoscopies more frequently. And often in individuals who are at increased risk, we start screening earlier than is recommended in the general population. And the goal of the increased screening is to detect cancer at an early stage where it may lead to better outcomes. The other way that genetic testing can be helpful is in guiding treatment choices as well as surgical decisions. So there are certain drugs or treatments that have been created to fight cancer cells while doing minimal damage to normal cells in the body. Those are called targeted drugs or targeted therapies, and there are some therapies that tend to work better for people who have inherited gene mutations. And genetic testing can tell a physician whether a person being tested is likely to benefit from that specific therapy or not. The next way that genetic testing can be helpful is in terms of identifying at-risk family members. So we know that family members share their genes in common, and that's what makes us all biologically related to our relatives. The parents, siblings, and children of an individual with a gene mutation have a 50% or 1 in 2 chance of having that same mutation. And extended relatives on both sides of the family may also be at risk to have the mutation. These mutations can be inherited equally among men and women, and fathers can pass mutations on to their daughters, mothers can pass these on to their sons. So it's really important for individuals who are undergoing genetic testing to share the results of their genetic testing with their family members. Sharing that information empowers relatives to learn more about their risks and make informed decisions about whether or not they want to pursue genetic testing. And it's really important that people not assume that relatives wouldn't want to know the outcome of their genetic testing. So it's important to share this information with as many relatives as possible. In addition to helping individuals better understand their risk to develop cancer, the results of genetic testing can also influence reproductive decision-making. So that's another important reason to ensure that this information is shared. So I'll end just by telling you that if you're interested in a visit with a genetics provider, the Smilow Cancer Genetics and Prevention Program is happy to see you. We have offices located all across the state, so we are sure to be hopefully located close to you. And there are ways to find a genetic counselor out of state as well. So if you ever need help finding a genetic counselor for a relative who lives not in Connecticut, we can help you find a genetic counselor for that relative as well. In preparing for your visit with a genetics provider, please make sure you've gathered your family history information. Our risk assessment and the genetic testing that we offer can only be as good as the information we have about your personal and family history. So we really do encourage you to contact relatives to clarify cancer types and ages at diagnosis in advance of your visit. Please also be sure to complete any pre-visit questionnaires, as this allows your genetics provider to be prepared for your visit in advance. And be sure to ask questions. We're happy to answer questions that you have. We want to make sure you leave the visit with a good understanding of the information we've discussed. And I'll put my contact information here, but I'm sure that can be shared as well if anybody would like a copy.
Thanks so much, Claire. Really important stuff. Maddi, again, I don't know if there was any additional content you wanted to share, or we can spend a couple minutes just on general questions. I saw a couple people had hands raised, and I think with the webinar, we can't do audio questions. So if it's possible to type the question into either the Q&A or chat at the bottom, that would be helpful. One question that did come in, Claire, you probably saw, it just had to do with, are all cancers detectable with genetic testing, or are some not detectable?
Yeah, so it's a great question. The genetic testing technology continues to advance. So I've been doing this for over 15 years now, and the genetic testing that I ordered now is a lot different than the genetic testing that I ordered when I first started. So we have genetic tests available for most hereditary cancer syndromes. That being said, there are still a large number of genes that we all have that we don't have any idea what they do. And so it's possible that we'll learn of new genes in the future. So it's a good idea for people who've had genetic testing to always contact their provider, their genetics provider, and see if there are any updated genetic tests that should be performed.
All right. Terrific. Another question just came in for you, Courtney. If I've completed my cancer treatment, may I still take advantage of nutritional counseling?
Yes. If you're still having follow-up appointments with your oncologist, you could see the dietitian through that oncologist. We also have a dietitian through the Survivorship program. And so, I'm sure Maddi can attest to that. But so you can also ask for a referral to the Survivorship clinic and meet with a dietitian in that capacity.
All right.
Yeah, kind of going off of that, Courtney, the same dietitian that supports the survivorship team also supports the integrative medicine team. So if you or any of your loved ones are looking for more specialized kind of advice as it relates to supplements and how they are interacting with any of your cancer treatment regimens, I would definitely advocate for the support or for the integrative medicine nutrition program as well. That's brand new. So we're really excited to have our registered dietitian resource as well.
Fantastic. Okay, well, I think that I don't see any more questions in the chat or the Q&A. And so if that wraps it up, again, I would encourage anybody, please, if there are other questions in the future, please reach out to us or your treatment team. And the theme that Maddi struck is absolutely right. We have a ton of resources available, and we are really eager to share them.
I'm not sure if it would be helpful, but I do have one more slide, and it was just our contact information. I'll just share that real quickly for everyone to have on hand.
And while we tune out, I'd encourage anyone who is free next Wednesday, tune in for social media myth busting, which should be an entertaining hour for sure.
Yeah, so the supportive care program, like I alluded to before, we are newer as of last year. So we kind of revamped the patient and family resource center to accommodate this team. So I definitely encourage you all to stop in the next time you're at the York Street Smilow campus. We do have the supportive care team in there from 8 a.m. to 4:30 p.m. Monday through Friday. And if you would like to learn more about our team or any of the teams that we support, I definitely recommend that you check out our online website. If you Google the Supportive Care Access Program, we're the first link that will pop up. So if you want to do some more education and research on your own time, definitely feel free.
All right. With that, everybody enjoy the evening. Happy summer solstice. And we will see you around the campus. Bye-bye.